Assalamualaikum everyone. I'm recording it separately to make it smoother. So today's session was about surgical career in UK. You might know me. This is Dr. Amara Salam. I'm working as a specialist registrar in NHS currently, and I've done my postgraduate training from Pakistan. So let's start. Seeing this picture really gives you goosebumps and brings a lot of excitement, adrenaline rush, and you feel like surgery. Wow, this is a very impressive field. But before you take this decision to enter into this specialty and pursue it as your career, I think there are a few questions that you should ask yourself. Why do I want to do it? Am I willing to do it for the rest of my life? And do I know what are the pros of it? And do I know what price I have to pay to become a surgeon? So, if we talk about the pros, surgery is a very rewarding career, which means that a lot of patients will come to you with problems that can be fixed. Um, so, a patient will come with acute appendicitis or with biliary colic, or they come with road traffic accidents, firearm injuries. So, when our surgical patients present, they are pretty unwell, and then very likely, if you are able to fix them, you're able to do a successful operation, your patients, you will save a life, and your patients will be really grateful to you. They will regard you, and you will feel happy that you have done a job that works. So you can see the product, a successful operation done will really make you feel happy. Then it is a skill, so which means that this is something that you do with your hand, and if you have an idea about being creative or about craftsmanship, if you do something with your hand, that gives you a special feeling, and you feel proud of yourself, which is again one of the pros. Then if you're a very competent surgeon, in future, your market value will be very good. You will be able to establish a very um, well private practice. You can earn a lot of money. You'll have a lot of finances. So we need to be honest about, everyone thinks about finances. Dedication and being sincere to your patients is definitely the utmost priority, but we all have to pay our bills. I'll keep it as simple. Then there are some downsides of this, of being a surgeon. There's very long, steep learning curve. You have to rely on a lot of factors. You will be in a learning phase at all stages of your life, because as you will progress in your career, the complexity of the operations that you do is going to increase as the years pass by. Your training is dependent on your environment and your supervisor. So if you're lucky and you have got a trainer who's patient, who's confident, who's competent, and who wants to train you, then you are lucky. Unfortunately, if you end up in a place where there is no culture of training, and people are not willing to teach you, people are not willing to trust you with an operation, then you will struggle a lot. Um, After that, we have long and social working hours. So, being a surgeon is different from other specialties, because in other specialties, for instance, we are doing an on-call shift, and you finish at 8, maybe quarter past 8, half past 8, you'll be able to go home, hand over, go home, finish. That's full stop. But if you're a surgeon, and if you're in the middle of a surgery and it's reaching your handover time, there are no nothing like that. There's nothing like that. You can't say that my time is finished and I'm going to leave. You're in the middle of an operation. So it requires a lot of commitment, and you have to be able to. Are you ready to decide? Compromise your working hours? Are you willing to work at nights? Are you willing to work on the weekends? There are a lot of specialties in general surgery. For instance, upper GI, lower GI, colorectal, which is they call emergency general surgery, where vascular surgery, where there is unsocial working hours. Even when you become a consultant, you have to compromise on your life commitments. Then this requires a lot of commitment, because it's a major undertaking, responsibility, lots of stress. Your one single move can cause the patient their life. You are very close. There are some crucial operations where you are very close to the vital structures. So, a lot of responsibility, commitment, work pressure. And then complications. So no surgeon can claim that they don't have any complications. If they do so, it means that they have not done enough operations. So are you able to accept them? Are you able to be brave enough, and are you able to accept your guilt, overcome your guilt, and keep performing when you encounter a complication? So that's another thing. This is a very nice page on the sort of a blog on Royal College of Surgeons of England page, and it gives you a brief overview of how life is as a surgeon, and how can you see surgery as a career. There's a slight insight into how to get a GMC registration. So there are pathways lab, which will be soon taken over by UKMLA. Then the other way to get a GMC registration is to get a Royal College membership or fellowship. MRCS or FRCS can get you a GMC. Third pathway to get GMC is sponsorship pathway, where a trust sponsors your GMC registration, and this is also called medical training initiative pathway. The posts are advertised with the name of MTI or International Training Fellow. This is a fee structure, current fee structure. Okay, if we talk about hierarchy, how things are working in UK. So we have around 4 levels at which doctors work. Foundation year 1 is what we call house officer, commonly in Pakistan and India, I believe so. And this is when fresh MBBS graduates, their first year of work is called foundation year or house job. After that, 2 or 3 years are foundation year 2 or SHO, which is senior house officer, junior clinical fellow, core trainee. There are lots of terms for this stage or level. This is then further progressed to specialty training when you enter the specialty training. So there are different terms for this level, either a specialty registrar, senior clinical fellow, senior locally employed doctor. So these are all terms that cover this level, sorry. This then progresses to consultant level, and before consultant, we have SAS doctors or specialty doctors, which is somewhere in between the consultant and registrar. Well, if you're planning to work in UK, you have got 2 options, training versus non-training routes. I will highly emphasize that go for a training route if it's possible for you. People who are early in their careers, who have just done their MBBS or they are planning to complete, focus on getting into the training. It's not impossible. It's it's becoming easier. The other pathway, for those who have already done some sort of work or training in back home, for them, they can enter into non-training routes. When you enter into training routes, training pathway, you have done a foundation year. So there are 2 stages there where you can enter into training. First is core surgical training, which is called CT1, CT2. So that's one entry point. The second entry point for general surgery training is a specialty training, where it's a 6 years training, ST3 to ST8, and then at the end of this training you complete your CCT and you get on the specialist register on GMC. If you talk about non-training pathways, so you must have done some sort of junior clinical fellow SHO level jobs, and then you progress, you complete your MRCS exam, and then you progress to a registrar post. While being on the registrar post, there's a CSER pathway or a portfolio pathway where you can work on your competencies which are required for CCT, the training pathway. So if you are able to show, get all the number of operations that are required, everything is available on the GMC website. If you are able to get those numbers, and then you give your FRCS exam and you've got a supportive trust, then it is possible for you to get on the specialist register as a CSER, or what they call it now, portfolio pathway. When you're applying for a training, competition ratios are very important, because yeah, ambition is good, but you have to be realistic. So these are the latest competition ratios for CST. It is 4.17, which means for every single seat, this is the number of applicants present. For general surgery ST3, competition ratio is 3.18, but these keep on fluctuating and every year they change. I have shared a few links where you can look at competition ratios for all the specialties, even acute medicine, dermatology, cardiothoracics, whatever. This is sort of a timeline, like how things work. What happens that somewhere in November, the applications are announced, vacancies are published, applications are announced. Then there is a like two to 3 week window where you have time to submit your application. Once this window is closed, then you are given a few weeks to upload the evidence. So whenever you apply, you have to you have given some information, and for that information you have to upload the proof. So that's the time when you have upload your evidence. Once you have uploaded everything, then they will shortlist you, give you a score. Depending on that score, you will get interviews, and then if you are successful in the interviews, the offers will be given, and then you will start your training. I think it's August. Okay, so I'll briefly go through both of the training points. Core surgical training is like 2 year training job. Applications are open via Oriel, which is a sort of an application where all sorts of training vacancies are announced, and then you have to apply through Oriel. By the end of core surgical training, you are expected to give your exam MRCS. So eligibility criteria of core surgical training is GMC registration, doing a successful completion of a UK foundation program. If you are an IMG and you have not done your foundation years here, there's a alternate form we call certificate of readiness to enter into specialty training. So you get that form signed and stamped by a supervisor or consultant, and then if that's accepted, then that's sort of an alternate to your foundation year training. How applicants are selected, these are a few things. I'll go into detail. So commitment to specialty is important. And if you come, so this is one thing like portfolio scoring. So all the applicants will be scored, and the maximum score is 52. And as you can see that these are the themes on which you will be scored. Operative experience, maximum point you can achieve is 8. The links I have shared, you can find all the details. Like for instance, it was if you have been involved in 40 operations, you will be given a score of 8. Less than that, there are some scores. So there's a range for number of operations and the score given. Then attending surgical conferences. After that, this is surgical experience, which means that you have done a rotation in a surgical department. Conducting a QI project has its own numbers, and then presenting that QI project has its own scores in the portfolio. And then doing the presentations, publications, and they also give you a score on teaching experience, which the evidence could be your feedback or a certificate from your department that you have done a teaching. And then training qualifications, it can be postgraduate certificate, diploma, train the trainer course, things like that. So in short, if we see that portfolio building requires your MRCS plus minus, operative procedures, courses, conferences, getting presentations and awards, postgraduate qualifications, conducting audits, QI, and then getting them published, teaching qualifications, teaching experiences, and leadership and management rules. Leadership and management rules, although it's not there in the scoring criteria, but this is an overall, sort of portfolio building guidance that these are the things you should be working on, because even for the non-training jobs, when you apply in NHS, the application will require you to answer in these fields. And there's one thing I would like to mention, that leadership and member management experience, it's nothing fancy. So simple, if you are doing a rota management for your department, you can get a certificate that you have managed a rota for like 6 months. If you were a chief registrar, then you can get a certificate for that. If you led undergraduate teaching for 3rd years, you can get a certificate. So it's all about gathering evidence. This is the e-logbook, so it's free. A lot of IMGs ask like, how can I keep a record of my cases? So it's very simple. You can just download open on your mobile phones and get registered here, and then you keep entering the cases there, and it gives you an option to print a consolidated report, and that report can be signed by your consultant back home if you're not in the NHS. So that's it. Coming to specialty training. So the second entry point is a specialty training where you enter at ST3 level. So it's a 6 years training ST3 to ST8. Again, the applications are made via Oriel. The requirement is GM3 registration and completion of MRCS. Now the applications open in November for the training that is supposed to be started next year, August. So they give you sort of a leverage that you can complete your MRCS by the April. So even at the time of application, if you don't have MRCS, you still have a few months. Again, specialty training, how is it scored? These are the themes. In order to get yourself longlisted, this is the least minimum that you require. MBBS, MRCS, like by the offer date, which is usually April, you should have your full MRCS, your employment history. Either you have done the core surgical training, or there is an alternate certificate that can be signed that you have the competencies achieved, which people achieve in core training. So this is the bare minimum required to apply for the training. Then again, there is a portfolio scoring, and there are 7 questions. So question 1 is time spent in surgery by July 2024. We are talking about this year applications. Maximum point that can be achieved in this question is number 6. And as you can see that the ideal number of months of time spent in general surgery is 25 to 36 months. So if you are planning to apply and you are reaching this threshold, I've seen people switching jobs, like they switch to medicine or cardiology, anything but surgery. Because if you see that if you reach like 61 months or more, which is around 5 years of time spent in general surgery, you will have the least number, like just 1. So this will negatively impact your scoring. Question number 2 is time spent in other surgical specialties, which means urology, orthopedics, neurosurgery, cardiothoracics, whatever surgical specialty you have spent the time. Now, the time should be at least 4 months, and the maximum point that you can achieve is 4. So if you have done like 2 rotations, 4 months each, that could get you the maximum number of points. Coming to question number 3 is the number of appendectomies. The e-logbook that I mentioned before, the way when you enter the cases, it asks you the level of operation. So it starts from being an observer, then assisting the operation, then performing the operation while the supervised and the trainer was scrubbed, and then supervised trainer was unscrubbed, like Peter trainer was present in the theaters and then performed where there was no trainer in the theaters for you, and then training someone. So all of these STS, assistant and observation, will not count. Rest of these levels, STS, STU, performed and trained. So these will be these can be scored, and the maximum number of points that you can get is 4, which is for 36 to 45 operations. So again, as you can see the trend that the more experienced you get, the more number of appendectomies you will get. It is going to negatively impact your application when it reaches a specific threshold. So the ideal number of appendectomies is 36 to 45. Then question number 4 is about getting publications. Now they have changed a lot this year. You're only expected to submit evidence of 2 best publications, and they should be PubMed indexed. 2 best would mean like in terms of RCTs are the best at topmost, or meta-analysis are on the top grid. Being a first author also gets you good points. So 2 best publications with the PubMed ID, and the maximum score that you can get is 10. Presentations is again 2 best presentations, and the maximum points that you can get is 10 points. International conferences, so as you can see, the regional will be scored at minimum, then national conference, and then an international conference. So international conference is the maximum weightage. Then we have question number 6 is about audits and QIPs. The maximum score that you can get on this question is 21 points. And if you have done a QIP or an audit cycle with two closed loops, you can get 8 points. And further audit, you can, so 2 audits or 2 or QIP with closed loops can get you 16 points, 8 for each. And if you have done a further audit, that will get you 5 points. So in total, maximum points achieved could be 21. Question number 7 is about UK higher degree or equivalent. So if you have a postgraduate certificate, diploma, master's, PhD, so this will get you scores. The maximum score that you can get is 5. These are the sources which I have used, and I have separately posted on my blog. And if you have any queries, I'm open. You can just put that in comments or inbox me. I'll be happy to help. Thank you, and take care, everyone. Good luck.